Premenstrual Dysphoric Disorder, often abbreviated as PMDD, is a health condition that affects women. It is a severe form of premenstrual syndrome, or PMS. PMDD causes intense emotional, mental, and physical symptoms. These symptoms occur in the weeks leading up to menstruation. In this video, we will discuss PMDD in detail. We will explore its symptoms, impact on daily life, and possible underlying conditions. We will also look at ways to manage PMDD. This includes coping strategies, treatment options, and the role of support systems. PMDD, or Premenstrual Dysphoric Disorder, is characterized by a specific set of symptoms that are both emotional and physical in nature. These symptoms are more severe than those experienced with PMS or premenstrual syndrome, and can significantly impact a woman's daily life and overall well-being. Emotional symptoms of PMDD can include intense irritability and anger, mood swings that can lead to sudden bouts of sadness, and heightened anxiety and tension. These emotional changes can make it difficult to maintain relationships and perform daily tasks. It can be quite debilitating. Women with PMDD often find themselves struggling to keep up with their responsibilities at work, home, or school. The emotional turmoil can be overwhelming, leading to feelings of hopelessness and isolation. Common emotional symptoms include irritability and anger, mood swings and sadness, anxiety and tension, and increased sensitivity to rejection. These symptoms can vary in intensity, but are generally severe enough to disrupt daily life. Increased sensitivity to rejection can lead to social withdrawal and a sense of loneliness. Women may feel misunderstood or unsupported by those around them, exacerbating their emotional distress. Physical symptoms of PMDD can manifest as fatigue and low energy, headaches and muscle pain, bloating and breast tenderness. These physical discomforts can be debilitating and add to the emotional strain. Sleep disturbances and appetite changes are also common. Women may experience insomnia or find themselves sleeping too much. Changes in appetite can lead to overeating or a lack of interest in food, further impacting their health. Diagnosis of PMDD involves tracking symptoms over several menstrual cycles. Keeping a detailed record of emotional and physical symptoms can help in identifying patterns and determining if they align with the menstrual cycle. This tracking is crucial as it helps healthcare professionals differentiate PMDD from other mood disorders. Consistent documentation can provide valuable insights into the timing and severity of symptoms. It is important to consult a healthcare professional for an accurate diagnosis. They can provide guidance on managing symptoms and recommend appropriate treatments, ensuring that women receive the support they need to improve their quality of life. As said before, it is not an exaggeration to say that PMDD can significantly impact a woman's daily life. The emotional and physical symptoms can interfere with work, relationships, and overall well-being. Women with PMDD may experience difficulty concentrating and completing tasks at work or school, strained relationships with family and friends due to mood swings and irritability, social withdrawal and decreased enjoyment of hobbies and activities, and physical discomfort that limits daily activities and routines. While the exact cause of PMDD is unknown, it is believed to be linked to hormonal fluctuations during the menstrual cycle. These hormonal changes can lead to a variety of physical and emotional symptoms that can be quite severe for some women. It is believed that it is the hormonal changes and/or individual responses to these changes are responsible for the mood swings, irritability, depression, and anxiety, as well as physical symptoms like bloating, breast tenderness, and headaches. Some studies suggest a connection between PMDD and underlying gynecological conditions, such as endometriosis, which can exacerbate the symptoms of PMDD. Endometriosis is a condition where tissue similar to the lining inside the uterus starts to grow outside the uterus, causing pain and potentially leading to fertility issues. This misplaced tissue behaves like normal uterine tissue, thickening, breaking down, and bleeding with each menstrual cycle. But it has no way to exit the body, leading to inflammation and scar tissue. This can cause severe pain, especially during menstrual periods. there is complex interactions of the various hormonal, physical, mental, and emotional factors in how PMDD plays out. Another condition linked to PMDD is polycystic ovary syndrome, or PCOS, which is a hormonal disorder characterized by irregular periods, excess androgen levels, and polycystic ovaries. Women with PCOS may experience symptoms such as weight gain, acne, and excessive hair growth. PCOS can also lead to long-term health issues like diabetes and heart disease if not managed properly. Additionally, uterine fibroids, which are non-cancerous growths in the uterus, can cause heavy menstrual bleeding, pelvic pain, and pressure symptoms. Effects of uterine fibroids may be associated with PMDD. These fibroids can vary in size and number, and while some women may not experience any symptoms, others may have significant discomfort and complications. The presence of these conditions can make the management of PMDD more challenging. It's important to note that not all women with these conditions experience PMDD, and not all women with PMDD have these conditions. Each woman's experience is unique, and the interplay between these conditions and PMDD can vary widely. Understanding the individual nuances of each case is crucial for effective treatment. Women experiencing severe symptoms should seek medical advice to explore potential underlying conditions and appropriate treatment options. More research is needed to fully understand the relationship between PMDD and gynecological conditions. Continued studies will help in developing better diagnostic tools and treatments, ultimately improving the quality of life for those affected. Creating a support system, family, friends, and workplaces is essential for women dealing with PMDD. This condition can be incredibly challenging, and having a network of understanding and supportive people can make a significant difference in managing symptoms and improving quality of life. Having a strong support system is crucial for women with PMDD. It can provide emotional stability and practical assistance during difficult times. Here's how family, friends, and workplaces can provide support. First, education. Educating oneself about PMDD is the foundation of effective support. Understanding the symptoms, triggers, and treatments can help in offering the right kind of help. Learn about PMDD to understand the condition and its impact. This knowledge can foster empathy and reduce misunderstandings. Second, empathy. Offer emotional support and validate her experiences. Empathy involves listening without judgment and acknowledging her feelings. Third, patience. Be understanding and patient during symptom flares. PMDD symptoms can be unpredictable and intense, requiring patience from everyone involved. Fourth, flexibility. Offer practical help with tasks and responsibilities. This can include helping with household chores, running errands, or assisting with work tasks. And finally, open communication. Encourage open communication about her needs. Open and honest communication can prevent misunderstandings and ensure that her needs are met effectively. Workplaces can create a supportive environment by offering flexible work arrangements, such as remote work options or flexible hours, which can help women manage their symptoms more effectively. Access to mental health resources, such as counseling services or wellness programs, can provide additional support and coping strategies. And reducing stigma around menstrual health. By fostering an environment where menstrual health is openly discussed and supported, workplaces can help women feel more comfortable and less isolated in their experiences. Coping strategies for managing PMDD. Several coping strategies can help women manage PMDD symptoms. Lifestyle modifications, regular exercise, a balanced diet, and sufficient sleep can help regulate mood and reduce physical symptoms. Stress management techniques. Engage in stress-reducing activities like yoga, meditation, or deep breathing exercises. Symptom tracking. Keep a journal to track symptoms and identify triggers. Support groups. Connect with other women experiencing PMDD for shared experiences and support. Exploring treatment options, from conventional to holistic. Treatment options for PMDD vary depending on the severity of symptoms and individual needs. They may include antidepressants, selective serotonin reuptake inhibitors or SSRIs are commonly prescribed to regulate mood and reduce emotional symptoms. birth control pills. Hormonal contraceptives can help regulate the menstrual cycle and reduce hormonal fluctuations. There are newer hormonal medications that are also available to deal with PMDD. Most of them work by regulating the hormones involved in the variations of menstrual cycles. Cognitive behavioral therapy, or CBT, a type of therapy that helps identify and change negative thought patterns and behaviors. The power of herbal and traditional remedies. In addition to conventional treatments, some women find relief with herbal and traditional remedies. Chasteberry, a herb believed to regulate hormones and reduce breast tenderness. Evening primrose oil contains gamma-linolenic acid, or GLA, which may reduce mood swings and irritability. St. John's wort, a herb traditionally used to improve mood and reduce anxiety. It's essential to consult a qualified healthcare professional before using any herbal remedies, as they can interact with other medications or have side effects. Conclusion: living well with PMDD. PMDD is a challenging condition, but with the right support and treatment, women can live full and meaningful lives. Understanding the symptoms, seeking professional help, building a strong support network, and exploring various coping mechanisms are crucial steps towards managing PMDD effectively. Remember, you're not alone and there is hope for a brighter, more balanced future. Thanks for joining us in this video. Don't forget to like, share, and subscribe to our channel for more educational videos of women, health, and related lifestyle issues.